Hello students, today we will study about transmission based precautions. So what are the types? They are contact transmission, droplet transmission and airborne transmission. So what are the causes and what we have to do for that? So what are the precautions? So we'll see in short contact precautions. Here isolation of the patient is important. Then personal protective equipments, patient's equipment should be disinfected, hand wash after touching patient, before touching patient, then environment cleaning, that is floor, clothes and toilet. Then in droplet the transmission, isolation of the patient, and patient should wear surgical mask and the healthcare worker should wear PPE, that is personal protective equipments and surgical mask. In airborne transmission, isolation of the patient should wear surgical mask and the healthcare worker should wear N95 mask. Now we will see what are the causative organisms. So for standard precautions, organisms are cytomegalovirus, HIV, hepatitis B, C, aspergillus. In contact precautions, the organisms are MRSA, then VRE, vancomycin resistant enterococci, adenovirus, diarrhea producing Clostridium difficile, rotavirus. So these are the organisms. In droplet, pertussis, influenza, Neisseria, Coxsackie, bacterial meningitis, mumps, rubella. In airborne, it is chickenpox, then measles, tuberculosis, SARS and avian influenza. So now we will see in detail. So first one is contact transmission. So it can be of two types, direct and indirect. So indirect, it is through the contaminated hands with blood and body fluids. Indirect, from the clothes, patient care devices or environmental surfaces like floor, touching the handle of the door and etc. The agents are most commonly are methicillin resistant Staphylococcus aureus, Acinetobacter, Pseudomonas, adenovirus, chlamydia, group A streptococcus, staphylococcus, rotavirus, vibrio, Clostridium difficile. So precautions here. So most important step, first one is the hand hygiene. Alcohol based chlorhexidine mixture of the sanitizer should be used for the hand rub or hand wash. Then personal protective equipments like gloves, surgical mask. Then single use patient dedicated equipment should be there, and patient should be placed in isolation room, or cohorting can be done. So cohorting means when the same group of symptoms if present in many patients, then they can be kept in a room together. So the space should be more than 3 feet. With the curtains you can isolate the patient. Second one is the droplet infection. So when it can happen, so respiratory droplets are more than 5 micrometer in size. So during cough, sneezing or talk, these droplets can spread the infection. So agents most commonly are diphtheria, the Corynebacterium diphtheriae, H. influenzae type B, meningococci, pertussis bacteria, then plague, mycoplasma, streptococcus and influenza. The precautions we have to take here is first hand hygiene, alcohol based or chlorhexidine based. Then personal protective equipments, healthcare workers should wear surgical mask. Respiratory hygiene and cough etiquette, that is proper cough procedure using clean cloth or tissue paper, and while coughing you should cover your mouth and nose. Then patient placement, it should be in isolation room. Cohorting can be done, so space should be more than 3 feet with the curtains applied for the separation in between patients. Then patient should wear surgical mask in transport, and then healthcare workers should wear the surgical mask, and disinfection of the room is there while discharge of the patient. Now third type is airborne transmission. So in that, aerosols less than 5 micrometer in size are produced during cough, sneezing or talk, and then it can be produced in procedures like endotracheal intubation, tracheostomy, sputum induction, bronchoscopy. And the microorganisms responsible for this is Mycobacterium tuberculosis mainly, then measles, varicella, SARS-CoV, COVID-19, MERS-CoV, smallpox, anthracis and aspergillus. So precautions, the first most important step is hand hygiene with alcohol and chlorhexidine used in that. Then PPE, healthcare workers should wear N95 mask or high level respirator, and it should be tested whether it is fit or not. Then respiratory hygiene and cough etiquette should be followed, like while coughing or sneezing you have to cover your mouth and nose with help of clean cloth or tissue paper, or if it is not there, then in the elbow you should cough or sneeze, so that aerosols are not produced and they are not transmitted to the environment. Then patient should be isolated in room with negative pressure. Then UV irradiation or HEPA filters should be used in that room. Then patient should wear surgical mask, and disinfection of the room is there after the discharge of the patient. Visitor and staff should be entry is restricted, and if they are visiting, then they should wear PPE, that is mask, clothes and apron or gown. So in airborne transmission, patients are placed on airborne precautions when they have known or suspected infections transmitted over long distances through the air. So organisms mainly are Mycobacterium tuberculosis, measles virus and varicella zoster, that is chickenpox virus. So airborne infection isolation room, AIIR. So ideally patient should be placed in that room. Remember, this is room specifically designed with a special air handling and ventilation system to prevent transmission of airborne infection. So it should include negative pressure, that is air flows from corridor to inside the patient room but not from patient room to outside, and 6 to 12 air exchanges per hour. So direct exhaust of air to the outside, away from places where people walk or congregate, and at any intake openings. A door kept closed when not required for entry and exit. These are my references from which we can study. I hope this session you will find useful. Thank you.